All right, so I'm going to start with the Heent assessment, assessing your head for any abnormalities, lumps, bumps, or lesions. And then I'm going to palpate your temporal pulses. Now I'll check your cranial nerves, so I'll have you lift your eyebrows as high as you can, close your eyes as tight as you can, then frown, smile with your teeth, puff out your cheeks, and then shrug against my resistance. Right, and then I'm going to palpate your temporal mandibular joints, so just open, close, checking for any clicks. And I'm going to test your light touch ID with the cotton ball, so just close your eyes, and when you feel the cotton ball, say now.
No, 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 no.
Right, now moving on to your eyes, I'm going to assess the outer structures of your eyes, looking at the subconjunctiva, assessing your lashes and your eyebrows. And then I'm going to check your EOMs, accommodation and convergence. So I'll just have you look over my shoulder and follow my finger, but don't move your head. And then checking convergence. Okay. Now moving on, I'm going to dim the lights and I'm going to check your pupils. First, I'm looking for direct constriction and then consensual constriction. And then on the other side. All right, now I'm going to assess the internal structures of the eye. So I'll just have you look right over my shoulder and try not to blink. First, looking for the red light reflex and at the vessels of the eye. Then moving in, looking medial. And then lateral. And then same on this side. All right. Now we're going to move on to the ears. So I'm just going to start by inspecting the ears for any abnormalities. And then I'm going to do the whisper test. So I'm going to say 3 words and just repeat them back to me.
Red, orange, green. Dog, cat, mouse.
Okay. Now I'm going to look at the internal structures of your ear. Pulling the pinna up, out, and back. And just checking for any wax and obstruction. Tympanic membrane looks pearly gray. And then same thing on this side. All right, now moving on to the nose, I'm just gonna look, checking for any deformities, any deviation. And then I'm gonna look inside the nose, looking for any polyps, checking the mucosa. Same thing on this side. All right, now I'm gonna assess the mouth. First, looking at the external structures of the mouth, the lips and the gums and the teeth. Then looking at the buccal mucosa, the soft and hard palate. You can lift your tongue, looking under the tongue, and then I'm just gonna check your gag reflex. All right, and then moving on to, actually for your nose, I skipped a step. We're gonna check the patency of your nose. So I'll just have you sniff, and then sniff. Okay. Now, moving on to the neck, I'm just going to assess that your trachea is midline, everything looks good, and I'm going to assess your lymph nodes. So first, checking the preauricular, the postauricular, the occipital, the posterior cervical chain, moving into the submandibular and submental, down to the anterior cervical and supraclavicular. All right, now I'm going to assess your thyroid. So for this, I'm just inspecting that there's no goiter or anything, and then I'm going to have you take a sip of water and keep the water in your mouth. And then I'm going to do the posterior approach. So I'll have you tilt your head down and to the left and swallow. All right, and then again for the other side. And then down and to the right and swallow. Okay. Now we're going to move on to respiratory. For respiratory, I'm just going to have you take off your sweatshirt. So I'm going to start by inspecting the chest, just making sure that everything looks symmetrical, checking the AP diameter is 2 to 1. Then I'm going to percuss the chest in the 12 different spots. All right. Now we're going to move on to listening. Well, first I'm going to have you stand up and face the camera, and then I'm going to percuss your back as well. You can turn this way. And then while you're standing, I'll just take a listen to your back. When you feel my stethoscope touch your skin, just take a deep breath in and out. Okay, and then you can have a seat, and I'm just going to listen to you from the front. All right, and now we're going to move on to cardiac. So I'm going to first palpate your carotid arteries one at a time. And then the other one. Okay, and now I'm going to listen to your carotid with the bell of my stethoscope. So I'll just have you take a deep breath in and hold. You can breathe. And same on this side. Deep breath in and hold. All right, and then I'll just have you lean forward. I'm checking for any pulsations or heaves in the chest. Okay. Now I'm going to listen to your heart in the 5 different spots using both the diaphragm and bell with my stethoscope. All right, And then I'm just gonna have you lay down over here and I'm gonna listen to your heart again. Alright, so again, I'm gonna listen with the bell and the diaphragm on my stethoscope. Alright, moving on to the abdominal assessment. First, just inspecting the abdomen. Then I'm going to percuss the abdomen. Or first I'm going to auscultate the abdomen. In all 4 quadrants. Then I'm going to percuss. And now I'm going to percuss for the liver border. And then I'm going to have you take a deep breath in and let it out, deep palpating the liver. And then I will palpate all 4 quadrants. Assessing the patient for any pain or discomfort. Alright, and now moving on to the peripheral vascular, I'm first going to assess the arms and feel for the temperature, looking at the color of her arms, checking her capillary refill, seeing if there's any clubbing of the fingernails. Then I'm going to palpate the brachial arteries. Then palpate the radial. Moving down to the legs, I'm going to assess the color of her legs, the temperature of her legs, checking for any edema. Then I'm going to palpate her femoral pulses. And her popliteal. Assessing her post-tib and dorsal pedis. And I'm just going to take your socks off.
Excuse me.
And I'm just going to assess your cap refill of your toes.
Chilly.
Looks great.